I feel like I get to cheat a little bit because I just heard 3 brilliant presentations about a lot of different topics on this, and I feel like I can just spend the whole time responding. And there's a totally super vibing conversation in the chat that I would also like to respond to a bit. And I think it works because all of these concepts and pieces that have come up are directly relevant to this question, like what the heck does legalizing psychedelics look like? So by way of super brief introduction, my name is Ismail Ali. It's super nice to meet you all. I live in California. I work as policy counsel for the Multidisciplinary Association for Psychedelic Studies. I'm an attorney. I've been working in human rights and criminal justice reform and harm reduction, mental health policy for about 5 years, and have been working with psychedelics in personal, spiritual, therapeutic, and other contexts, including with my family and others very close to me for about 15 years. Including having experiences, as Timothy mentioned, in amazing harm reduction communities like Cosmic Care, as well as the Zendo project here in the United States. So I'm really glad to be here, really glad to be having this conversation because I think about it a lot. And as you've already heard, there's a lot of different perspectives and kind of angles. So I'll give like a very short kind of high level perspective of some of the maybe answers or perspectives I have to the question that's brought up in this panel. And then I'd actually like to respond a bit to some of the things that have come up today so far and in the chat as well. And I know we have more time in the Q&A, but I want to make sure to cover as much as I can in a very short period of time with a very big question. So the first thing I want to acknowledge and appreciate is what Timothy said at the beginning, that there's no road to legalizing psychedelics, that we are making it. I think that's true in the sense that a lot of the policy kind of angles that Tim Schell also mentioned in his presentation are all relatively novel. Like we have a strong sense that certain things will result in certain things, like medicalization will result in rescheduling and so on. But it is true that compared to a lot of other substances, including cannabis, we're on quite a different track than other substances and other big kind of policy legal movements. One thing to read, maybe just to go a little bit deeper on the comparison to cannabis, because I actually do think that's a helpful one. And it's helpful to understand kind of the whole timeline. So Tim started us off with the legalization of adult use in Colorado. And if you zoom back a bit, you actually start in the 1980s with a movement that started with mostly HIV positive and other people really looking toward medical marijuana as a solution for wasting syndrome and other cancer and related things in the 80s. So the movement toward medical marijuana really was pushed originally in many ways by a patient need, by a need from some sort of medical use. And we all know that over the course of the 90s, this thing came up where it's like, as I think Richard Hartnell mentioned in the chat, well, you're just doing this so people can smoke their weed or smoke their pot or whatever. It's not for medical use. And the answer is obviously yes and, right? It's like, of course, there is medical use and of course people use it for other reasons. But what's interesting thing about cannabis is that you had kind of a track where you had a clear kind of push from a patient group. You had a conversation about medical use. You had literally a decade or more of just focusing on this conversation about medical use. What kinds of things, where does the research come from, et cetera. And then adult use kind of fell in. Now you're actually starting to see this whole kind of full-fledged industry that a lot of people have problems with and a lot of people are really excited about. The thing about psychedelics that's interesting is that you have organizations like MAPS and USONA and others who have been doing some of this kind of back end, this research, safety and efficacy research for 20 years or longer. And up until a few years ago, I think the assumption was that there would be somewhat of a similar track where you'd go medical and then there would be adult use and legalization and da-da-da. It seems to be the case that we're kind of like stacking all of these uses at the same time, in the sense that I think that there's actually parallel tracks happening right now for medical use, including FDA or EMA or kind of regulatory approved drug development, as well as kind of more, I would say less regulated adult use, which I think is really well referenced by the example that Tom gave, what you see in the Netherlands, where you have, it's not that it's totally unregulated, but it's definitely not as regulated as kind of pharmaceutical drugs. And there is some like level of adult use, and you see something like that kind of happening in the state of Oregon in the United States, which just legalized a psilocybin services system, which includes therapy, but it's really not medical in the sense that you don't have to have a diagnosis. you have a medical evaluation to see if you're contraindicated out, but it's more for like healthy normals and just making sure that others are pulled out instead of ensure that people with diagnoses are pulled in. So that's a really helpful thing to remember. It's like, is there a diagnosis that hinges, is treatment based on a diagnosis or not? If it's not, then it's going to be available to a huge amount more people. And that's where you look at like these adult use schemes that are outside of like the more structured medical system. And of course, at the same time, you have the move toward decriminalizing, which many people pair with legalizing, but as I'm sure a lot of people in the audience know, it doesn't have to be the same thing. And the interesting thing about decrim is that I think that it feels like it works as a step toward legalization for some people. And I think decrim in a less regulated system actually poses a threat to business interests, which is why in cannabis, you've seen a huge move toward regulating and licensing of the cannabis industry and a continued kind of penalization of people outside of the licensed industry. This is what we need to avoid, because I think if we're in a situation in the long term, we have a lot of access through like licensed, paid for systems, which surely have maybe good quality control, surely have oversight, things that we do want, but you can't like pick mushrooms in a field and eat them out of the ground. Then we're going to be in a system that's really only going to be good for people who have money and not for people who don't. So this move toward decrim does have to do with creating markets or creating access in ways that don't necessarily have to go through these like super highly regulated systems, whether they're medical or whether they're closer to adult use. Now that also comes with risks. And I think to Tom's point, which I think is really right, like we have to have an acceptable risk tolerance. Like there's a lot of things I can legally do that are very risky for me. And I think that as an adult, like we should have the choice to do those things, and we should have appropriate guardrails and support for people who have trouble with those things as we do for other activities. So a couple things I think, and just to go a little bit deeper into this, what Timothy was saying around the costs of the psilocybin research, the licensing, all of these pieces, this is kind of precisely what people are worried about, where you only have a system in which highly sophisticated actors can enter the industry. Meaning that the average person may not have the capacity to enter the industry broadly or even afford the product. Of course, I anticipate a broad range of things being available in the long run, and MAPS is really committed to ensuring that multiple routes of access are available. We're not medicalization purists. We think that medicalization is one route that's really important for the grandmothers, for the people that will only go to see people in white coats. But a lot of people who go to underground shamans would never see someone in a white coat. And a lot of people who go to people to see white coats in clinics would never go to see a shaman. So there's just a reality that there's going to be, if we're talking about access and actually creating kind of a broad base of availability, then like we actually do have to have a plurality of methods, and that's going to be really important. I want to talk a little bit about the kind of tension between the politics and principle of this whole process, because I think that one of the things that comes up is, as was mentioned a lot in the chat, is both these two factors. One around like, what are the risks or benefits of commercialization and bringing in for-profit actors? And then the other side, I think, is, well, if we're working in a political context, what are the costs of working with a broad political base, including people on the political right? Or that are more politically conservative. And as like, there is a very real concern about the way that political leverage is used in ways that cause harm. And that's something that I'm no stranger to. I've been working in criminal justice reform and civil rights for a very, very long time. And I think that there's a real politics side of this, where it's like, if we are working toward a political framework or political protection, which requires changes in laws, then there is a requirement to have some sort of broad base of support. I think it's impossible to do it with just one side of the aisle, if you will. The question is then, like, what are the costs of that, and what are the negotiations and things you're willing to compromise on? That is a really, really big open question. So I'll talk first maybe about the commercial side, and then I'll go back to the politics, because they're both kind of woven into each other. So one thing that one myth I'd like to dispel is that descheduling something through medicalization would actually impact criminal prohibition. There are multiple substances that are not Schedule I that are still highly penalized. And I think that, going back to this example with cannabis and with other drugs, it is absolutely true that in many cases there is an interest in having a highly regulated industry and then not allowing people outside of the industry to be engaging. So I think that if for-profit business is going to be moving forward in this space, if it wants to do it in a way that's really ethical in the interest of the entire movement as a whole, and I think of the entire community, it's really important that it avoids protectionism and it is really careful not to especially fight politically to ensure that criminalization maintains just so they can keep kind of market share. And that's part of why I started who I started around MAPS's focus. We're really not trying to monopolize or focus on medical only, and we do a lot of work to make sure that other routes outside of medical are available, because we know that that's going to be essential to this. So really quickly, I'll copy we made a short policy document a couple of years ago that I just pasted in the chat. So you can take a look at like a high level political kind of perspective and strategy. And if you follow us in about a month, we'll be, or maybe less actually, we'll be releasing an article about our analysis of what happened in Oregon, which decriminalized all drugs and also created this psilocybin services system. So we can think about what is like the big next step. I think that there's an interesting angle here that was mentioned by a couple people. I agree that this evidence-based thing may or may not actually be an effective political strategy. There's lots of evidence that the current political system, the current kind of drug control system is a failure. And I think that it is not necessarily true that politics is based entirely in that evidence. I agree with Tom, it's based in media. I agree with others that it's based on these other factors. So I think that it's really important to just be like practical about how far research can actually take us. And that's why I agree that we should do the science. I agree that we should show them, but we've been showing them for like 4 decades. Like the science is good. There's lots of great science about it. Like we can show that these things are relatively safe in the right context, that they do have risks, that those risks can be mitigated. So I don't think it's just about the science. I think the science takes us part of the way, and the science will help us with like FDA and MDMA, but the science is not going to take us to convincing the hearts and minds of people who are not ready to be there and don't want to be there. One big factor that has made a huge difference in the last few years, at least in the United States, and I wonder if this is true in Europe, but it has a lot to do with what people are calling like, the opioid crisis. I prefer the term overdose crisis because I think that opioids are part of it, but it's also about a poison drug supply. What that means is that we're in a position where people, there are really very few families that have not been affected by the overdose crisis, that have not been affected by substance use disorder or depression or suicide. So we're not really in a point where we don't have an uphill battle to prove that there's a mental health crisis anymore. People get that. So now kind of approaching this toward a more solution-oriented kind of direction has been really helpful and is quite politically viable. This goes a little bit into the question. Well, actually, I'll say one more thing about the commercialization stuff, and then I'll briefly say something about politics, and then I know we have to wrap. There's just so much to say. But I'll say that I'm really curious about the way that like commercial ventures actually move forward in this space, because I'm curious about the premise that they're going to be necessary in the way that I hear a lot of people claim. The reality is a lot of these substances are already available in the underground. There are people who are making and manufacturing these drugs all over the world. They get to the places where they want to get to or where people want them. And I think that there is a level of capital that is necessary in scaling it. Like Tim mentioned, MAPSR has raised over $100 million in doing that through donations. And I think that because a lot of those numbers have been invisibilized by prohibition, because a lot of those numbers are in the underground, it's actually hard to tell where the drugs are always coming from, how much it costs to actually make them, how much it costs to get to people. So I do think that this is why like bringing in the question of what is the cost of regulation, I think really matters, because that is the factor that's going to have the biggest difference in whether or not companies or individuals or organizations or groups are actually able to proliferate different substances in different places. And I'll say one other big ethical thing I think about this, which has to do with sourcing and where the substances come from. I think that there's a question about like the cultural sourcing. I'm going to put one more link in the chat to an article that myself and some colleagues just published about ethical concerns of psilocybin patents. I think that there's a big question about how we handle patenting and how we handle the use of information and data, and also the use of personally collected data. As Tim mentioned, there's going to be a lot of move toward like wearables, biotechnology, and so on. I really wonder where all that data is going to get used, and if all of these companies are ensuring that they're structuring themselves in a way where they don't have to sell or use their data in inappropriate ways. The use of data is changing quickly. It's it's getting increasingly difficult for someone who consents to their data being used for one thing to know what their data might be used for 2 years down the line. So I think there's a lot of really big questions about how we deal with privacy, how we deal with these things that are not solved yet, and that for-profit industry has not solved because the incentives are bad. So I really look forward to the possibility of something that's more visionary, that actually responds to some of the problems of current industry that fail to really protect consumers in the way that they intend to because of the fixation on profit. And then lastly, around politics, this is a really complicated one. I mentioned in the chat that the way that MAPS works is multi-partisan. I prefer that term to bipartisan, because the idea that there's only two parties or a few parties, I think, is a myth. I think that there's two party systems that a lot of different types of people have to opt themselves into, but that's not the whole picture. So I think that thinking about how to work with different political actors on different sides of the spectrum is a major factor, partially because of this point that I made earlier about evidence. If the science itself isn't enough, like what are the other things that are needed to make sure that there's actually some level of buy-in from people who who believe that they have certain constituents to follow up with, right? Like so much of politics is not just like what the constituents actually believes, but it's what the representatives think their constituents believe, which is where media comes in and all this other stuff. So I think there's a big question about how, like, what that line is, and MAPS is constantly figuring out what it is. We're constantly blurring it. These, people have mentioned in the chat that there's a lot of things that people have called MAPS out on because of our willingness to work with certain political actors, and I think that's a very real fear. I'm a queer, multiracial Muslim person in California. I'm not losing sight of like what the stakes are here. Like I really understand what's going on in that sense, and I think that there's a kind of pragmatism that can be balanced with that like real politic and reality that is difficult, but is realistic. And I'll just maybe end this one piece of the conversation, because I know we have Q&A, with this really interesting anecdote. When I've found myself working with people who are more politically conservative, I don't just mean Republicans, I also mean people who are maybe politically progressive, but scared about drugs or have had drug issues in their family and are really like in this kind of fear state about that. The thing that I found to be the most effective is actually reminding people, although Timothy, you're right, like people do use these recreationally, everyone's mentioned that, yes, that is the thing that people do. It's actually helpful for people to remember that psychedelic therapy, or the healing process that comes with kind of dealing with unrepressed emotions, is not a fun process. I think once people remember that there's actually a lot of challenge and that it's actually a difficult personal journey, a lot of that stigma that comes from like pleasure seeking or whatever people are afraid of starts to dissipate, because people are like, well, why would they be doing this if it hurts or if it's difficult or if it's hard? Like I think the assumption is that there's this kind of hedonistic aspect to it. And that is where I think the science really does help, because that's where I think you can say, well, there's actual people who've actually gotten significant personal benefit from this. And it wasn't just because they were partying the whole time. Now, I do believe you can get significant personal benefit from just partying, but I think that's only part of the picture.